as a hospitality professional, what can they do to help themselves?
When you think about the kind of behind the scenes, the kitchen environment, it's a threat-based environment. It's hot, it's noisy, it's a confined space. It is like a boiling pot, essentially, of all of these things. So it's about what represents your safe system.
I was an assistant psychologist in a psychosis service with someone who was hallucinating and hearing voices. The trauma and the experience that this person went through will always stay with me. I'll never ever forget this person.
It's really important to know that everyone in the world, you have mental health, same as your physical health. Everybody seems to go, well, are you physically fit? Are you not fit? Blah, blah, blah. It should be the same with your mind, you know. It's how do you keep that muscle active and as creative as possible without trying to get into a dark space. For the first time ever, the Chef JKP Podcast is going live. We're going to be at Time Out Market Dubai as we bring the heat with unfiltered, exclusive conversations featuring some of the biggest names in hospitality. Mark your calendars. April 13th, 20th and 27th for 3 unforgettable nights of behind-the-scenes stories, insider secrets and culinary revelations. Want in? We are giving away tickets. All you have to do is follow both Instagram accounts and keep your eyes peeled for your shot at winning a pair. Don't just listen, be part of the experience. All right, my friends, this is it. One of the most important conversations we have ever had on the Chef JKP podcast. Now, we talk a lot about food, hospitality, and what it takes to be at the top of your game. But today, we are diving into a topic that every single person listening or watching needs to hear. Whether you're a chef, a business owner, a student, or someone just trying to get through the day. Because, let's be very honest, mental health really matters. And today we are joined by 2 absolute powerhouses in that field. Dr.Bisi Laniyan and Dr. Gurveen Ranger, both brilliant clinical psychologists based right here in Dubai at Sage Clinics. These 2 experts have dedicated their lives to understanding the human mind, helping people navigate stress, anxiety, burnout, trauma, and everything in between. Now, let's be honest, in this industry, it's fast-paced, high pressure, often brutal, but mental health isn't just about hospitality. It's about all of us. So, whether you're feeling overwhelmed or you know someone who's struggling or just wants to understand themselves or yourselves better, listen closely. Because what Dr. Bisi and Dr. Gurveen share in this episode today, it could genuinely change your life. There is so much to unpack. So, let's get straight to it. Time to rock and roll.
I'm Dr. B and I'm a clinical psychologist.
Hi, I'm Dr. Bisi and I'm a clinical psychologist.
If you like the podcast, make sure to follow, share and subscribe.
Bisi and V, warm welcome to the show. Now, just a pretext for everybody, both of you are psychologists, which is really incredible to have you both in. However, you know that you're on a foodie podcast. Mm-hmm. So, first of all, Bisi, I'm going to ask you, can you tell me your first or favourite childhood food memory?
So my mum used to prepare this dish. It's called suya. So it's a Nigerian dish. It's almost like a kebab. So it's like finely sliced bits of beef with this seasoning, and it's so nice. And it's served in newspaper.
Oh.
Yeah, it's served in newspaper with onions, tomatoes, and that's how it's served in Nigeria. It's like a street food. So one of my favourite memories is on Fridays, my mum actually used to supply a restaurant with that. So she used to make it at home, come home from school, eat as many bits of the beef as I can, and then she'll pack the rest and take it off. And it was always really nice.
Wow.
Yeah.
And we've never spoken about Nigerian food on the show,
Yeah.
so that's a really, really nice one.
Yeah.
And V, for yourself?
I'd say it's similar. It's my mum's cooking. So my mum's authentic Indian cooking, especially her yellow dal. I'm obsessed. I'm still obsessed. I'll try and get her to stock up every time she comes over. And it always just reminds me it's that kind of authentic cooking, and it has to be the way that she makes it. That's definitely one of my favourite memories.
So then for both of you, when it comes to the, let's say, the family meals, can you tell me the sort of things that were on the table, what was going on, who was around, you know, the atmosphere?
My mum was quite strict. So at the table, there was no talking. It was concentrate on your food, don't choke. And you finish your food, and then you can have your drink.
Right.
And then you can engage in discussion.
Okay.
So it was very, she had a system.
Right.
And we grew up eating a lot of Nigerian food, which is actually my favourite. So we'd have lots of rice, cassava, beans, pounded yam, which is one of my favourites. There'll always be like a protein, so either like a fish, a chicken, a beef with some sort of stew. Food was always spicy, and that's one of the reasons why she said no talking whilst you're eating, because if you're eating lots of spice and you're just there chatting, you're more likely to choke.
Oh, right, okay.
Yeah, like choke.
Right.
Yeah, the spices go up your nose or something.
Okay. So, because I have to ask. So, number one,
Yeah.
what is pounded jam?
So it's literally pounded yam. So it almost looks like mashed potatoes. So
Right.
it's yam. So you boil the yam.
Oh, okay.
And then you pound it. And then you almost shapen it to this kind of like round
Okay.
shape. It's almost like a smooth mashed potato.
Right.
And then you would eat it with, we call it soup or stew. So you might have like a spinach-based stew. So it has spinach in it, different types of spinach leaves, tomato, spices,
Right.
and then bits of meat in it, or you can have chicken.
Wow. And tell me about the sort of Nigerian spices. Because I have no clue. And when you're talking about spice, for me, is it about necessarily about heat or more about flavour?
Both.
Okay.
So the suya that I mentioned earlier, that is heat. That is really, it's hot. And then pepper soup, that's hot. But jollof rice would be like a sweet.
Right.
It will have a sweet taste and a bit of spice. So maybe like a Scotch bonnet type.
Oh, so it's still like quite...
Sweet, yeah, sweet red pepper taste. I'm not a chef, so I don't actually know all the terms.
No, but...
But it's a nice blend of sweetness and flavour as well as literal heat.
Right.
So cold drinks, milk after. But it's so yummy.
But I was going to say, so you were introduced to the hot spice from a young age?
From a young age. I would say that so when I stopped drinking milk, we would start eating like pounded jam or like ground rice, without the spice, but with maybe with okra, or with spinach. I have to translate the names in my head. And then as I grew up, I was introduced to spice.
Right.
And I love spicy food. And it's hard to say, oh, it's medium spice, because to me, this is medium spice, but to someone else, it might be extremely spicy.
Okay.
Yeah.
And V, for yourself?
Yeah, so I guess my memories are always, it's in like Asian culture, being from an Asian background, it's very social. So I just remember being around family. It's always like food is very much the central of those social gatherings, right? Like mixed table. Unlike Bisi, though, it's a bit of a running joke in my family. And she knows about how much I can't tolerate spice.
Right.
I'm like the worst Indian in my family. It's been a running joke since I was very small. Like, what is wrong with you? Like, why can you not? And I've never been able to tolerate it.
Right.
But I get it. It's also about the flavour and the heat, right? But for me, it's more about the heat than it is the flavour.
Because, no, I mean, and tell me, which part of the UK are you from?
From Berkshire.
Okay,
Yeah,
and so with your family, again, were you introduced to spice and heat from a super young age?
I would say yes from a young age, but then I guess because we were originally from closer to kind of West London,
right?
And so there's a bit more of a community there, and like more family around. So it was a lot more social, a lot more kind of authentic cooking. As time kind of went on, moving into Berkshire and stuff, I'd say it was probably a bit more mixed. So like in terms of what was on the table, it was a bit more of a mixed bag, I would say.
And when did you find out that spice was your nemesis?
Very young, from the beginning. And then being the butt of all the jokes.
Oh, okay.
Yes,
right.
From when I was introduced to it very young, I've never really been able to tolerate it.
But do you like then the sort of more milder spices, let's say?
Yes, definitely the milder spice, because it still has the flavour, and I really love the flavour of Indian food. Like I love Indian food, but yeah, when it gets too hot, then I'm out.
Fair enough. So then I wanted to ask the both of you, within psychology itself, you know, it's quite, I would say, well, tell me if I'm wrong, but a torturous path in terms of the education, because there's so much that you have to pick up. But I was interested, when did you make the conscious decision to really go into that field? Bisi, I'll start with you.
Psychology?
Yes.
So when I was doing my A-levels, I actually thought I was going to go into law. And then a friend of mine said, I'm going to study psychology because of this is what psychology entails. And I was like, oh, that sounds like what I want to do. And once I made that decision and I went into university undergrad, I kind of knew that I had to stick this out, because a psychology degree is one of those degrees where after you graduate from your undergrad, you're unable to practice as a clinical psychologist unless you have the doctorate in the UK. So you kind of have to go the whole way through.
So in terms of time, if people don't know, can you tell me how long it takes to study for an undergrad?
So I did a 4-year undergrad degree. I think typically it's about 3 years, but I did a major and a minor.
Right.
So I did a year abroad, but typically 3 years undergrad, and then you can decide to do a master's. A master's isn't compulsory, but it helps in terms of getting a new set of skills, and developing your analytical skills, your critical thinking, and also you can start to build on an area of specialism or an area of interest during a master's, and then you go on to a doctorate. But there are also diplomas and trainings and things that you can do in between before you even get to the doctorate level.
Okay, and then, sorry, so doctorate level is how long?
3 years.
Okay, so, and was it the same for you, V?
Similar. So I actually thought I was going to be a journalist before, and I remember doing my work experience at the local newspaper and things, and I was committed to being a journalist and all of this. And then I did my psychology A-level,
right,
and was like, this is fascinating, just in terms of how the mind works. I loved my psychology teachers and like their passion for it. So that's what made me change my mind. And then I ended up pursuing psychology. So I did a 3-year undergrad. And then I was working in various kind of parts of the NHS for a few years before I did the doctorate, which is the 3-year kind of course that came after that.
So then that leads me on to the next question. Guide me through, if I'm like a 5-year-old, the training landscape to be a psychologist, because obviously you train, right? So or you studied for 3 years or 4 years, which is quite studious, let's say. But nobody really tells you how to deal with humans, right? Who then have very, very serious mental health issues. And then you're going into the training like a proper live field exercise, if you will.
Yeah.
How was it?
Eye-opening, I would say. And this is why, so they often say like to be working for a few years before you go on to do the doctorate or apply for the doctorate, because you do need that real world experience. I remember my first NHS job was in an inpatient adult mental health acute unit, and it was eye-opening because this is my first experience of kind of mental health, and it was obviously at the severe end, but you really start to see, I guess, the nuances, or, you know, and learning about people's histories as well, just trying to like make sense of people's stories in different settings, I think can go a long way. Like, you know, when you're training or you're doing the courses, there's a lot of theory as well as the kind of practical. So this is that real world hands-on experience, and like no person you meet will be the same, and
Absolutely.
their story will never be the same.
Yeah.
So actually getting that exposure, I think, in between the two kind of degrees is really helpful, because it does give you that other side, that lens to kind of how you understand people and how we make sense of struggle as well.
Right.
Yeah,
and did you find the same thing, Bisi?
Yeah, I also would like to add that not just the clinical experience, but just the random work experience. So I remember I did street fundraising. So asking people to sign over or give me their bank details to sign over or to pay, for like a direct debit for like Oxfam, Friends of the Earth.
Yeah.
And that experience actually really helped me with relating to people, because that is the fundamental of what we do, right? It's that rapport building, the ability to build relationship. And you can actually develop that skill in any job that you do, not just the clinical. So you're working in retail, an angry customer comes to the till demanding a refund, you're unable to give the refund. It's how do you manage that kind of conflict? How do you speak to them in a respectful way, yet being assertive? So you learn all these human based skills in a variety of work experience and job roles that you have even before you get onto training. And it actually helps you with training because you have experience with people.
But I want to also understand, you know, from a real life perspective, without divulging too much information, of course, you know, were there during your times of training, you know, any particular sort of incidents that really sort of stuck in your mind through those 3, 4, 5 years of training?
Yeah. So when I was, so this was before training.
Right.
I was an assistant psychologist in a psychosis service. And I remember shadowing a session with my supervisor with someone who was hallucinating and hearing voices. And I'll be honest, I was a bit like, it felt a bit intimidating being in that space.
But you weren't alone, right?
No. I was with my clinical supervisor and the client.
Okay.
So because that was my first experience of someone experiencing these live or symptoms of psychosis, that will always stick with me. And then there's another client that I worked with when I was doing my older adult placement, and just the trauma and the experience that this person went through in early childhood, that will always stay with me. I'll never ever forget this person. And I found that a lot with the older adults,
Right?
Because they're from a completely different generation, and how they dealt with challenges so different to how we deal with challenges, and also how we're being trained to have these conversations.
Right.
So there were a few clients or a few patients during my older adult placement that will always stay with me.
And V for you?
Yeah, I think what comes to mind as you were kind of talking is I remember when I was working in that inpatient unit actually, and there was a young girl, she was probably kind of 20s, I would say. And I just remember, so she'd come in with a severe mental illness, and she would spend, like, I think her first couple of weeks, she would literally be in her room on the ward by herself. She wouldn't engage with anyone. She wouldn't speak to anyone. Very kind of isolating, like would very reluctantly come out for meal times and things like that. And I just remember slowly, and again, it's that rapport building that you were talking about before. Right. It's just that kind of gentle approach just to kind of help socialize somebody, not push too hard, kind of meet her where she's at, and actually just seeing her over time come out more. And like my role on the ward was to do kind of activities, so there would be like cooking classes, gardening, relaxation sessions and things like that, right? So I was providing the occupational activities for the patients, and slowly she just started to kind of come out of her shell a bit and start to do more skills-based stuff. And actually seeing her in a gardening class or in a cooking session, where actually at home, I think because she was unwell and there's kind of certain cultural perhaps narratives about her illness and what that meant, that actually she'd been quite de-skilled and had never really had the opportunity to take part in these kind of things. and actually seeing how she was starting to enjoy that, and actually a lot more capable than perhaps she was led to feel a lot of her life.
Right.
Like actually, and just seeing that change in her over, she was probably there for about a month, I would say, in total. And the difference from when she came in to the end, that's something that will always kind of stay. And this is someone who was pretty much mute at the beginning. And then she just kind of, it was a completely different person by the end, which was really nice to see. And it's kind of moments like that when you see someone's journey from that, which can be, you know, it's something that definitely stays with us.
But what would you, again, in your opinion, during those times of the training, what would be, let's say, the most common things that you would see from the mental health space, whether it was a psychosis, the trauma, the childhood trauma? What are the sort of most common denominators?
I guess depression and anxiety is probably the most common.
Right. Absolutely.
It also depends on where you train. So the doctorate training, you do get experience in different settings.
Right.
So a lot of my experience was in the severe mental health domain because that's where I wanted to work in afterwards. But depression and anxiety, I would say, is the common thread amongst all of the settings, whether it was the adult setting, the child setting, the older adult setting, or, you know, that's a common theme, I would say, across all of those placements that, and I don't know about you.
Yeah, absolutely. And then you see in real life the stats of 1 in 4 because the people that present, they're different. Different professions, different socioeconomic status and classes, different races, different ages, because we're trained across the lifespan. So we have our children and adolescent mental health training all the way up until adults, and in between we might do a learning disability and then specialist training. So we're trained across the lifespan. So just seeing the range and variety, just the mix of people, but then mental health being presented, and it almost bursts that myth of mental health only belongs to a certain group of people. It's a Western thing.
Right. Because I mean, that's very interesting. So even a super young child could get depression.
Yeah.
So it doesn't, I mean, because it's very interesting to know that, you know, and I think that's probably, I don't know, but probably where it stems from, their environment, all the things that they went through as a young kid, or, you know, they were left alone, so on and so forth. So it's, I think it's quite full on.
You see a lot of kind of those comorbidities. So anxiety maybe might be the primary problem, but then actually when you think about quality of life, when you're so anxious and things like that, can lead to impact on mood and things like that. So it's so nuanced, isn't it, between people?
No, I think so. Excuse me. And also, it's such a big topic, so that's why I've got so many questions for you. It's really, really big. But for then, if we break it down into what you do, what would you define as the clinical term for mental health?
Health?
Because there's, I mean, it's such a wide, I mean, it's depression, it's anxiety, it's trauma. How do you then sort of block it into different areas when you're dealing with patients?
So I think when we think about mental health, we're just literally thinking about the state of our mind, our emotions, psychology. So mental health as a term does not mean an illness. Okay. So the people that we tend to see are usually in 2 categories. People that have a diagnosable mental health condition, so that present with clinical anxiety, clinical depression, and other mental health difficulties that have a diagnosis. And then also people that want to get a better understanding of themselves. So they might not meet the criteria for a diagnosis, but maybe they want to understand why they do certain things. Maybe they want to learn how to manage stress or manage burnout, or they want to challenge some of the unhealthy patterns that they've noticed in relationships. So when we think about mental health, especially in the clinical setting, we're thinking about what the client actually presents with. So what are they finding difficult? How is it impacting their life? Is it reducing their quality of life? Is it stopping them from working, from engaging with people socially? So there's some sort of impairment. And then we're looking at things like severity and also duration. And those tend to be the things that we would use to kind of define like a mental health illness. But mental health, just as a term, is the same as, like physical health. If I talk about my physical health, it doesn't mean that I'm sick. It's just about the state of my physical being. Yeah.
And I guess it kind of also about the question about labels and things like that, right? Some people find it really comforting to have a diagnostic label if that's appropriate, whereas others actually don't. And as psychologists, we often, what we do is kind of formulate.
Yeah.
So this is just, how does this difficulty make sense in the context of one's life experiences, one's biology, one's environment, and all of those kind of things, right? So we don't necessarily have to be label focused either. It's just like, okay, there's a struggle or there's an area that's impacting you. How does this make sense?
Yeah.
Whether that's depressed mood or anxiety or OCD or psychosis, like how does that make sense in the context of your life experiences, your biology, all of those kind of factors, right? And trying to just make sense of someone, because we all have mental health, right?
Yeah, that's the other thing, is that I think, I come from an era where mental health was not spoken of, and they were like, what are you talking about mental health? Shut your mouth. It was just like, but I think it's really important to know that everyone in the world, you have mental health, same as your physical health.
Absolutely.
Exactly what you just said. And everybody seems to go, well, if you talk about fitness, but are you physically fit? Are you not fit? Blah blah blah. It should be the same with your mind. It's how do you keep that muscle active and as creative as possible without trying to get into a dark space. Now, both of you are practicing here in Dubai, and you're in Sage clinics, right? So for anyone who doesn't know where you are or what you do, can you just explain? Because I think it's really important for the viewers and listeners to know that there is this phenomenal place where they can go and have a chat.
Absolutely. So we're a mental health and wellbeing clinic, and we see people across the lifespan. So we work in a perinatal space with children. So we've got a group of child psychologists that work with us. We've got a specialist eating disorder service, which is across the lifespan as well. And then we've got, Bisi and I, we work with adults, and the other psychologists that work with adults and older adults. So it's across the lifespan, really, thinking about kind of whatever may come up in that space, depending on where you are in life and things like that. And we're based in downtown, so it's kind of quite a central location as well. And I think alongside the therapy, we also have, we look at corporate wellbeing. We go into organizations. I did a workshop last week about psychological safety in the workplace. So it's thinking about the psychology of teams as well, and kind of how to create kind of productive, thriving teams in a psychologically safe way. So there's the kind of corporate stream, corporate wellbeing, burnout and things like that. So there's kind of that side of things. But also, and I think something that's definitely very more prevalent, or is, I guess, more talked about perhaps, is the kind of, we do those assessments for ADHD, autism, things like that. And actually, we have also adults coming, I think, when they're kind of starting to, I think because there's more narratives around these on social media, more people are raising awareness of signs and symptoms, and more people are coming forward to be like, actually, that sounds like me. How might this help to be able to understand myself in this way, and think about then what does that translate to in the workplace or at school, depending on your age and things like that.
Because also I wanted to understand, because Dubai is such a melting pot of nationalities, how is it working with different nationalities here? I mean, you've got obviously the Emiratis, you've got people from the region, people from the US, UK, from India, Pakistan, Sri Lanka, Philippines. So how is it working with different nationalities?
It's interesting. So I think the first thing is that human connection, because before I'm Nigerian British, before you're British Indian, we are humans. So it's connecting with people on that human level first. And then we work in culturally informed and culturally sensitive, responsive ways. So Gurveen mentioned earlier about labels. So if a client presents and they are not comfortable with certain labels, and they maybe describe some of their distress or their challenges in a particular way, I personally would go with that. I would use their words. Because I'm stepping also in a way into their world. Yes, I would use their words to get an understanding, and also just being curious. As psychologists, we don't have all the answers. Okay. We are trying to put pieces of the puzzles together through our formulation to make sense of someone's experience and someone's world. And we come with our training and our experience of working with several clients and several populations to help make sense of that. But the client ultimately is the expert on their, exactly.
Yeah.
So we work collaboratively with them. I'll give you an example. When I first came, I used to hear the word Yanni a lot.
Okay.
Yeah?
Yeah.
And I was like,
Who's Yanni?
Who is Yanni? Who is
Is he a friend of mine?
who is this Yanni that everyone seems to know? Every Arab seems to know. And I asked one of my colleagues.
Is it a TV show? Like,
I asked one of my clients. I was like, "Can I just stop you? What's Yanni?" And they were like, "Oh, it's a filler word. It's basically means like they were a young person, like, or literally."
oh, right, okay.
So it's okay to be curious. That's actually part of the human experience.
That's cool, no?
Yeah.
Yeah.
And it also helps with that building of relationship. So, so that's one of the ways So that's one of the ways that we would kind of respect people's cultures, honor people's cultures. There's nothing wrong with being curious. There's nothing wrong with asking questions as long as it's in a respectful way.
Yeah, absolutely.
And I think, it's about adapting practice accordingly, right? Like we have to meet the person where they're at and how we make sense of them, how they help us make sense of them.
Absolutely.
A lot of like therapy models, they're often researched on Western populations, right? So it's not going to be a direct translation here of like the same things that work over in our NHS days will work over here. And it's about being kind of aware of that and actually adapting accordingly to make sure that we're meeting the person where they're at so they can get the most out of the work, essentially. Like we can't just apply what we're used to applying in one population across the board.
Yeah, absolutely. And also the cultures and the traditions here, of course, different to what would be in the Western field, for example, and so there's a lot of that going on. But I wanted to also ask you, so look, if I put these words together, straightforward: trauma, depression, anxiety, burnout. These are the main ones when I think about sort of mental health.
Yeah.
How, for both of you, this is a question for both of you, I would like to understand, how do these manifest themselves within us, right? So Bisi, I'll start with you.
Okay, so if we look at, I will start maybe with depression.
Yep.
So depression can manifest in this sense of not wanting to do things, this sense of like hopelessness, thoughts of what's the point, things that maybe you previously enjoyed no longer pique your interest, or you no longer want to engage in that, negative ways of appraising life, even pleasant situations, neutral situations. There's this kind of almost like looking at life through really dark lenses. So that will be like a common manifestation. Sometimes anger. And I think that anger is one of those emotions where people just think of aggression, but sometimes the underlying emotion could be like sadness or fear. So we would always be screening for anxiety or depression when people present with lots of anger, because there's links between irritability and depression. So just holding those things in mind, not necessarily wanting to socialize, withdrawing, changes in how you eat. Maybe you're eating loads or you're not eating enough.
Oh, okay.
Yeah. Sleeping, but the sleep doesn't feel restful. You're waking up constantly in the night, or you're struggling to sleep. So those will be some of the common manifestations that I'd be looking out for, but also how someone physically presents as well. And I think about this more in that social setting with friends. If you see a friend and they're used to dressing up in a particular way and all of a sudden they look different, just check in, because that might be, not necessarily, it might be an indication of something. Someone who I guess likes wearing makeup and getting their hair done, all of a sudden maybe they're not doing that. It's important just to kind of monitor that and just ask as a friend with that love and care if everything's all right. So that would be depression. Do you want to do anxiety or?
Yeah, and I guess what I would say with any of those is often the way we see them manifest, it's usually in our bodies,
right?
Our emotions, our thoughts, and our behaviours. So exactly like those symptoms that you just described for depression. So if we were to do that for anxiety, if you think about anxious thoughts, they're usually worry-based. They're usually what-ifs. Thinking gets a lot faster, racing thoughts. And it's like a lot of people will describe that they can't think of anything else but the thing that's worrying them. It's literally like a ruminatory loop that's going on in our mind. And that's usually a sign that our brain is in threat state, right? When we're feeling anxious, our fight or flight is triggered.
Okay.
And so our brain goes into threat state, and it's literally, it becomes very rigid. Our thoughts are very rigid, inflexible. And that's why because essentially it's our survival mode kicking in. So if you were actually in danger, you need to be fixated on the threat. So that's what's happening in our bodies when we're anxious or we're stressed. Like if our cortisol and our adrenaline is high, that's how it kind of presents in our bodies. So thinking, it becomes very fixated on the worries, very ruminatory. In terms of like anxiety and burnout, it will often present, these kind of, so a lot of people will come to see us when they've had multiple physical health checks and they're all coming back clear. And it will be things like headaches, gastro issues, or I'm having heart palpitations, and they're going to like cardiologists, gastro specialists, and having all of these tests, and they're all coming back clear or inconclusive. These are often signs of stress and anxiety, and that's when we'll start to formulate in that way. Okay, so you've had these checked out. There's no physical explanation for these. Could it be that actually it's the adrenaline and cortisol that's in your body that's activating this? That lethargic feeling, I will normally, if someone's coming saying that they're experiencing that kind of low energy, low motivation, extreme tiredness, I will always say get a blood test first. Rule out those physical causes. If that comes back all normal, then let's start looking at this. We'll also be looking at their environmental factors and stresses and be like, look, this sounds like it could be anxiety or stress based on what you're describing, but let's just get that checked, kind of things, because it is such a physical manifestation of this stuff.
So what I wanted to also mention is that now, in my opinion, again, you can tell me if I'm wrong, and I think obviously that women's brains work a lot more faster, way ahead, more maturely than men's brains, right? That's my opinion. I'll tell you why. Because I have 4 sisters. I'm the oldest guy, and obviously, my wife. And, especially my wife, she's very much seems to sort of think at a 90 miles an hour, always thinking, and I'm like a soldier. Just tell me what to do and I'll do it. Straightforward, right? Straightforward. But then when you mention about anxiety specifically, the one thing that I hear a lot of is specifically that word. So you've got the depression part of things, but also the anxiety. When you have an episode of anxiety and you are sort of swirling these thoughts continuously around, how do you break that cycle? Because it must be quite exhausting.
It is exhausting.
Right? And you're right, it manifests itself in different ways, whether it's eating too much food, not eating enough, things happen, palpitation, whatever it may be. Health-wise, you've done your check, you're all good. But then, not sleeping, not resting correctly. So how if it was my first time and you've never seen me before as a client, what are the things that, the top 3 things that you'd say to me, look, this is what we would advise you to do?
I guess it's different for different people. And what I often say when people come in, because there's no one size fits all in terms of a skill or technique. So I'll usually say, look, I'm going to introduce you to a bunch of stuff. You're going to go out and try it. Tell me what you like. Tell me what works. We're going to make your personal toolkit, essentially, of anxiety management. Because, we have some. So mindfulness, for example, right? Mindfulness is a common one. There's a lot of kind of talk, but it's such a broad word, right? And some people associate that with meditation and being in this Zen state. And I'm like, yoga. No, and I'm like, I don't know anyone who's Zen. I don't know anyone who's naturally that Zen all of the time, myself included. Don't even try. So it's managing some of those expectations, and actually mindfulness can be very practical. It's about focusing on your presence. So we might even, and I'll do it in the room with someone, I'll be like, right, okay, pick up that object that's in front of you. And I just want you to really look at it as if you've never seen it before. And then they'll do it. They're looking at me a bit weird. Like, what are we doing here? Why did I really come for this? But actually what they're learning from it, and what I will ask them to reflect on, what were you thinking about while you were doing that exercise? And it creates a break in the cycle of ruminatory loops. It just stops the spiral, essentially. Because you're grounding grounding yourself with something in your present.
Absolutely.
So some people like the more kind of meditative breathing exercises, because again, that can be quite grounding, really good for anxiety, because if you think about that fight or flight, like our breathing's dysregulated. So we'll normally start quite physical with anxiety, but it's kind of it might be mindfulness, it might be relaxation, it might be something, it might be exercise, right? If you've got all of this excess adrenaline running around your body because you're high stress or any of these. So I'll usually say, I'm going to show you a load of things over the next couple of weeks. You practice them at home. Tell me what you like. Tell me what you don't like.
Yeah, absolutely.
Bisi, what would you do? What would you advise?
Similar, to be honest. I'll also ask what they're currently doing and maybe invite them to think about a time in the past where they felt anxious or they felt really stressed. What has helped? But similar to V, I would probably be starting with the physical, because it's hard to challenge some of these thoughts or to categorize some of these worries. Is this a real worry? Is this a hypothetical? Is this practical? Is there a solution for this? It's hard to do all that practical stuff when the body is in that threat state. So things like the breathing, the relaxation, just activates that parasympathetic nervous system just to get you calm, just to get you relaxed, so you can actually engage the part of your brain that allows you to do that higher level stuff, the thinking, the sorting out the worries. Is this relevant to me now? Is this actually important? So similar to you, really. Yeah,
getting in that soothe system so that you've got that flexibility of thought to be able to then do the other work. Absolutely. I guess, right?
Because the other thing that comes up in therapy a lot is that people, or the word that comes up is tools.
Yeah.
Right? So again, if I'm talking about whether it's depression or anxiety, what would you say are the sort of, difficult to say, I know, from your job, but what are the top 3 sort of tools you would give your clients when it comes to whether it's depression or the anxiety?
Okay, should I go? Do you want to go? So with anxiety, one of my personal favorites is breathing. So like breathing exercises and just anything really that helps relax the body. So we think in breathing exercises, progressive muscle relaxation, grounding. I'm also a fan of having a journal or having a book, having somewhere where you can offload those thoughts and those worries that are just running and dancing around and having a party in your brain. And
but I love that.
Just putting it down on paper so you can actually see in black and white what is troubling you, what is worrying you, what is causing or contributing to this anxiety. And the third thing that I would say probably for anxiety, and this is very generic, again, it depends on the person. What would be a third thing that I would say? I would say sleep. Yeah, I think that sleep is probably one of the biggest hacks.
Yeah.
The more tired you are, the more vulnerable and susceptible you are to experiencing things in just a more intense way. So those will probably be the 3 things maybe for anxiety that I would typically start with.
And I guess for depression or low mood, in a similar vein, so kind of thinking about the behaviours, the feelings, the thoughts kind of thing that we were talking about before. So and often the number one thing that we talk about when we're working with someone with depression is activating yourself.
What does that mean?
So if you think about, so like a lot of the symptoms that Bisi described for depression is that withdrawal. It's withdrawing from the world, withdrawing from people, kind of life becomes, or the world becomes a lot smaller, right? We stop doing the things that we usually enjoy, our hobbies or any of those things. So activating ourselves kind of just looks like doing something.
Yeah.
Anything that will bring about even a little small bit of that sense of achievement or mastery or pleasure, anything. And like I often say, it doesn't have to be that big social event, for example. So one part of our soothe system, as well as regulating ourselves with like relaxation or breathing and things, is also our social system, like how safely bonded we are to people. So it might even just be like messaging a friend. It doesn't, not expecting yourself to go to that social event that you've been avoiding for however long. Doing something small in the house, going for a walk. You know, it doesn't have to be a full workout routine, and often people come with the expectations that I need to get back to doing exactly what I was doing straight away, or I failed in some way. And actually we're kind of saying slow but steady. It's that gradual activation, because if the motivation isn't there, the thought of doing a full
Yeah.
exercise routine or going to that social gathering, it just feels like a mountain.
Absolutely.
And it becomes that self-fulfilling thing if that's what we're aiming for it. So it's that slow, steady activating yourself, just doing something, whatever you have capacity for that day.
So
and
that's what
building
you
on
would
that.
say. That's what you would say to clients. Let's say if they kept falling back into a dark space, because of course you can give them all the tools possible. But is it quite common for people to fall back into that dark space?
Yeah, it can be. And I guess so part of the work, we do kind of work quite holistically. So we're looking at all of the contributing factors to
Yeah.
this as well. So for some, it might be kind of a reactive depression, for example, based
Yeah.
on circumstances around
Right.
them. And those circumstances might then change. For others, this is kind of might be a long-standing kind of historical triggers that are resurfacing, whether that's in a relationship or, a particular context, maybe at work. So we're kind of trying to get to the bottom of perhaps what's triggering
Yeah.
depressive episodes,
Right.
thinking about kind of intervening in a holistic level, right? So it's about how do we relate to our internal world? Because once you learn that, it kind of doesn't matter what the trigger is. You're approaching it in the same way. And I guess our job as therapists is to skill people up to be their own therapist,
Amazing.
not to be
Right.
their therapist for life, right? So we
Absolutely.
want to give them the skills and the way, not just the tools, but also the understanding of
Yeah.
themselves.
Okay.
So that kind of being able to reflect. So as well as activating oneself, it might also be like, what's happening with your thought patterns? How do you challenge that? Like, what's the evidence for and against when we're thinking about these things? Because that can come in handy anywhere, whether it's an anxious thought, a low mood thought.
Yeah.
So it's about helping people understand themselves enough to then be their own therapists,
Yeah. Okay.
essentially going forward, so that when life stresses, there's always going to be something, right? Like
Absolutely.
things return.
Yeah.
You may have a period of a few years where things feel quite settled, but then bam, something happens, and it's about, okay, how do I understand this in the context of what I've already learned about myself, but then what helped me last time?
Yeah.
Okay.
As well as sometimes people do return for therapy. Sometimes it's just kind of a skills refresher. Sometimes it might be understanding something in a different way with this new trigger. So it's just about dealing with what's coming up. Is it a similar to what was happening before? What helped me back then? And sometimes having that outside support to just guide
Right.
in that moment can be really helpful. Other people are like, okay, we always try and do what we call a therapy blueprint at the end of therapy, which is to like sit at in that final session or those last two sessions where we might be putting together everything you want to remember, everything you want to take away from this work, everything that you think is going to be valuable to you going forward. And that's the resource for those recurrents, right?
Okay.
That's when it returns. It's like, okay, let me go back to my blueprint. What was it that actually helped me last time? Because it does, life stresses, things happen. It will, it does come back sometimes.
So then if you take me behind the scenes within your job. So let's say I'm the client. Okay. I've never been to therapy in my life. I thought therapy was like, for people who, I would never go to therapy because I don't need to talk. Been pushed to do it, but also, I'm nervous. How would you get somebody who really is very stubborn, doesn't want to talk about their feelings and anything that's going on internally? How initially, how do you get them to open up? Because I can imagine, again, you can tell me if I'm wrong. In my opinion, I think women tend to talk more openly than men. And especially, let's say, from different generations. The older generation, I think, were probably taught not to open up at all. Just keep
Yeah.
it in. It's fine.
Yeah.
Whereas I believe now the younger generation are starting to open up a lot more. But how do you get those clients to just initially open up, Bisi?
Again, back to that rapport building. And also normalizing that it's scary.
Right.
Yeah. I'm an absolute stranger.
Yeah.
You don't know me. You don't know what to expect in this space because you've never been here before.
You're going to be judging me.
Yeah, completely understandable. Yeah. So normalize that what you're feeling and maybe being closed up initially is quite common. Yeah. And also share with them that many people feel like this. What I usually do is I usually say to people that I will take things at their pace. So I'm not going to push. I'm not going to back you against the wall. Sometimes I might be a bit pushy if I think we're dancing around a particular thing that I think may be important to address. But I will take things at your own pace. So that rapport building, how do we connect to people as a human? Jokes, a bit of banter, we ask questions. We always take that curious stance, and ask open-ended questions, and just think of ways to connect. And again, it takes me back to my fundraising days, because within the first 5 seconds of meeting the stranger, you had to click with them in a way that they will give you at least 10 minutes of their time, so you can quickly say your spiel and hopefully they sign up. So it is thinking about what ways can we connect. And most clients, they fill out some sort of form. So it might say, I've come with anxiety. So I might say that, I've noticed that you've written that maybe you're experiencing some anxiety. That's really common. Do you just want to tell me about what that feels like for you? And if they don't necessarily want to go down the route of emotions or thoughts, I might say, what does it feel like in your body? Where do you feel it? When do you notice it? Is it in the mornings when you wake up? And we can start from that somatic, physical place before we get into maybe the thoughts. And I think that a lot of people think that they're coming into therapy and we are going to make them open all the boxes of their childhood, and we're going to dig up childhood trauma, and we're going to blame their parents for things. And that's not actually the case. If you just want to talk about a discrete thing, so something that maybe is happening at work, we can do that. We can go with that. If we notice that actually this is a pattern that maybe is occurring in other settings, then we might name that and invite the client for us to bring it into the therapy space. But it is a collaborative experience. And when we say collaborative, we mean that the client is as much as an active participant as the therapist. We are not coming in as a dictator saying, this is what you must say, this is how you must open up to us. That's not our job.
Or that this is what's gonna help, right? So I think that collaboration, I think, is key. And often we'll kind of, there's so many different therapy models, there's so many different ways of making sense of something, right? It's like some are more exploratory, which may be a bit more kind of talking about old patterns, old experiences, how they relate to you as a present. Then there's some that are more skills based, and then you can have a combination of the two. And what I will often try and do is kind of to offer different options and be like, what do you like the sound of? What sounds more like something you want to go down? Because it is that collaborative experience. It's about, the client is as much part of their recovery journey. Like, we're here to kind of guide. So we're like, okay, we can work this way, or we can work this way, or we can do a combination of the two. What do you think?
Absolutely.
Sometimes we have people who maybe have had bad experiences in the past of therapy as well. So I think also checking those out, like, what, how is it being in this room? What has been your history with that? Have you ever done anything like this before? Like, sometimes people will say yes, and actually it put me off, and I haven't done this for years because of that. Other people are like, this is completely new to me, I don't even know what to expect. So it's just kind of like laying the land, like, today this is just the kind of things that it would be helpful to know about, but tell me what you feel comfortable with telling me. As you were saying, like, we're strangers at this point. So
it's slowly
and challenging some assumptions, or naming and discussing some assumptions that people might have of what therapy means, right? Like you were saying about childhood, there's often that old kind of joke about like lying on the couch when you come into the room. It doesn't. We do have some very nice sofas in our clinic room.
Good to know.
But I promise you don't have to lie on them. And like, it can be, if there is that assumption, because that's what's portrayed, I guess, in the media and TV and like certain kind of maybe narratives about what therapy is. So it's just kind of normalizing and challenging some of those.
But also, I think you also need to make them feel safe, that they can actually open up. I think that's actually super key. So that environment of welcoming them into that specific space.
Absolutely.
It has to be also, beautifully designed, or welcoming, warm, relaxing, whatever it may be.
It starts before they even come into the clinic, right? Like, even the process of booking an appointment, to be fair, that's probably one of the most daunting steps. And often people will say it's just getting through the door in that first appointment is the hardest step, is the making that decision that I'm going to go and see a therapist and following through it. I've had people come who said, like, do you know what? I've been trying to do this for a year, and this is the first time I've actually got through the door. And there might be various reasons for why now, but actually it's making that commitment to make that appointment and turn up
Yeah.
is often the most anxiety provoking part of it. And when they get in the room, and actually it is more like a conversation, you know.
Absolutely, yeah.
We don't sit there with our forms to be like, okay, we need to ask this. It's like a conversation. Like we're kind of gathering some information, but it's a bit more, you know, it's a chat to start with, isn't it? It's about just exploring.
Yeah.
Like, oh, what does that mean then? Like, what happens when that happens? That thing that you're describing. So stuff kind of happens organically, and I think that's the best way, as opposed to it being quite rigid. So it's getting through the door in that first appointment. So it does start before you even come in, right? Is this a welcoming space? Does it feel calming? Does it feel safe just sitting in this waiting room, for example? So that's something we have to think about, right? How do you create a whole experience that feels safe before they've even come into your room for the first time, in terms of the consulting room?
Yeah. And there are a couple of things that we do as well. So, for example, offering a discovery call. So a discovery call is an initial maybe 15-minute chat with the client. And it's an opportunity for them to ask questions about the process. Is it even worth coming to a therapist for this difficulty? I want to ask you questions about how you manage someone like me, or how you work with someone like me. It's an opportunity to almost alleviate some of those fears and some of those worries about coming into the therapy space. And another thing that we do to really emphasize that safety is we have an explicit confidentiality sort of spiel that we give, not necessarily a spiel, but telling people that actually this is a confidential space. What you share in this room is between us. Yes, there are limits, but ensuring that people actually know that we respect and we honor the fact that they're coming here and they're sharing things that they find challenging, and they're sharing things that they find difficult, and we will respect that, and we will keep that safe with limitations as much as we can. And I think that that's also important for people to know as well. For us, it's kind of like we just do it because this is how we practice. But for a lot of people, it's really important that they hear it, that they hear that we listen and we don't judge.
Yes. Yeah, exactly. Yeah. No, because also, again, within the Middle Eastern landscape and families being involved, you know, where are you going today? I'm going to the clinic. Okay, which clinic? Or I think that's a key thing as well, because that confidentiality piece is, you know, super important value to that person, you know. But also, as you were saying that, I was also thinking about, we did an episode called Ego is the Chef's Worst Enemy. And I think you also have some people who have got that ego coming in and saying, well, I don't need therapy. I don't know what you're talking about. But I think that rapport, that connection is absolute key. Yeah. Now, the big word of the day for today is hospitality. I'd like to get your thoughts on the industry and how you feel about it. Not about as in what we do, but, you know, do you see many people from hospitality coming to you?
That's interesting. I would say, in my experience, especially in Dubai,
yes,
not very often. And not very often.
What about in the UK?
In the UK, yes.
In the UK, yes.
I would say, I did see a few people that worked in the hospitality space.
Right.
Yeah.
And what about yourself?
I would say a handful, yeah. Like it is, I would say a similar experience UK to here. But I would say what I did notice, I guess, for people coming from the hospitality industry is that themes often are the same in terms of triggers. When you think about, you know, high pressure environments, long hours, you know, perhaps things needing to be of a particular standard, kind of feeling like you can't maintain those standards. Like there tends to be themes, but obviously it will be very different from one person to the next.
Yeah, I mean, look, the first one I wanted to sort of get in there, which is really, really important, is what we do, and I can speak on behalf of quite a few people, specifically within hospitality. Number one, so I'll go into front of house and then I'm going to go into back of house. So front of house, I believe, in my opinion, because I'd done it before. So when I was 16, I had my first waiter's job and I became a psychologist. I had to figure out the guest within 3 seconds of them walking in to understand what they needed, what mood they were in, were they going to give me a tip, were they not, I had to like make that snap decision very, very quickly. Whether I was in a good mood or bad mood, doesn't matter. I had to perform. Right? So that was number one. Then you go into the back of house space, as you said, highly pressured. You know, there's a lot of pressure, emotions, rage, anger, that sort of thing. But from both sides, it has to work. You know, hospitality, restaurants, hotels, whatever it may be, it has to work because it's coming from a place of love. Because we love to give hospitality, people that love to please. But then, after many years of keeping emotions in, you know, things happen, right? And you know, as you know, I did a TED talk on the Vesuvius effect, which is a metaphor for the exact same thing. You keep your feelings inside, bubbling, and then all of a sudden you explode. Now, if I don't have these tools as a hospitality professional, I think it could be quite dangerous. What are the sort of tips, again, that you would say to hospitality professionals in order, if they don't have the funds or they're not able to necessarily go to therapy, what can they do to help themselves?
And I guess, well, exactly like you said, you're working in a threat-based environment, right? There's there's the kind of the threat of customer experience and satisfaction. But then when you think about the kind of behind the scenes, the kitchen environment, it's a threat-based environment. It's hot, it's noisy, it's a confined space, it's probably quite dangerous at times.
Oh yeah, knives, fryers, whatever you want. Like,
everything is going to be activating your threat system that we were talking about, right?
Personalities, I think that's the most dangerous, right?
Yeah, right? So it is like a boiling pot, essentially, of all of these things. So it's about what represents your soothe system.
Right.
How do you regulate yourself? And I think there's probably twofold, because there's the in the moment stuff.
Yes.
What do you do in that moment when your threat system and you're about to explode? Is how do you regulate, whether that's the breathing that you were talking about, like taking those 5 minutes to just ground yourself. It doesn't even have to be 5 minutes. It could be 2 minutes where you're removing yourself, grounding either through breathing or focusing on something cold. Like, so often we say kind of splash your face with cold water. That's a really good in the moment strategy for when we're experiencing this high intensity of emotion, whatever that emotion is, anxiety, anger, like any of those things. So,
you know, we have in the kitchens, you know, we have literally boxes like the size of this room. They're called walk-in fridges or freezers. You literally walk in the freezer.
Perfect place.
Have a scream. Get out again. You're fresh as a daisy.
But exactly, that's exactly what we would recommend. Use what you have in your environment.
Absolutely.
That's perfect.
Yeah, absolutely.
And it's soundproof, even better. Right? So
us trying to explain to clients to be like, oh, you need to kind of fill up a sink of cold water. Like, listen, you've got it available.
So basically,
to
you're changing your environment.
Yes, because you have to work physically in that moment. Like, there's no point in it. You can't even think clearly to do anything else, right? You have to work with your body.
Absolutely.
If you're tensed up, you need to do something to move those muscles to kind of make them more fluid, because you're essentially counteracting the threat response in your body.
Right.
If you're breathing shallow, you've got to regulate it. If your body temperature has gone up, which it will in that environment anyway, but then also because of your anxiety, get into that walk-in fridge. Perfect. So you're working with your body in the moment.
Okay.
But then it's also kind of the wider stuff, isn't it? Right, actually, is how do you regulate yourself in general?
Yeah.
Because if you think about going into that environment, your baseline's already going to be higher than, say, the next person who's not in that environment. So how do you keep yourself regulated outside of work? Because that is going to help you when you go in that workspace, right? Because
and when you say regulated, what does that mean?
Sleep, diet, you know, are you getting downtime where you're not thinking about problem-focused stuff, work-related stuff, anything else that you can...
And I think that you mentioned earlier in that 3 seconds into meeting someone, you're already kind of analysing. So also that self-awareness, recognising how am I feeling today? How have I been feeling this past week? Because if you've been really irritable for the whole week, it usually indicates that, okay, maybe you need to take a bit of a break. And I don't mean like not going to work, but actually thinking about, am I using my downtime? Yeah. Okay. Am I relaxing? Yeah. Am I doing things that I enjoy that doesn't involve work? Am I thinking about non-work stuff, non-problem focused stuff. Yeah, so knowing yourself is really, really important for that kind of self-regulation. And like V mentioned, things like sleep, the boring stuff, which we always talk about, like the boring routine stuff, is actually so important, because what that does is it cultivates this internal sense of safety. The things like sleep, the things like diet, the things like exercise. If you're in that threat state, think about your cortisol levels and your adrenaline. You have a lot of energy. That energy needs to be spent. So doing things like exercise, movement, dancing, going for a run, those are good ways to help regulate. You're regulating your physical body, and in regulating your physical body also has an impact on your emotions, and that also has an impact on your behavior. So how you show up at work, how you interact or engage with your colleagues or with customers.
I think it's such a big topic, because I was talking yesterday, in fact, before I even knew what anxiety was, when I was working in London, the normal hours was 18 to 20, the working day, wow. Right? And in those, and then you had half an hour to get home, 3 hours to sleep, half an hour to get back to work.
And how many days a week?
I did that for a long time.
Wow.
Right, long time, and a lot of us did, right? And you're just running, on adrenaline and cortisol. I think at the highest possible levels, because you're in Formula One kitchens. And my alarm was always I was meant to be at work at 6:30, because if you don't get there on time, everybody's always stealing the pans. Okay. So you've already stitched yourself up, right? But I would set my alarm for a very specific time, so around 6-ish. And then I would always wake up at 5 a.m. before the alarm with my heart. I had no idea what it was. I just thought it was normal. And then it ended up being anxiety, So recognizing those patterns, I had no clue what it was. I was just like, this is normal.
Normal. And also, I think some people also describe, in the beginning, it can feel quite exciting and quite driven. And like a lot of people who end up burnt out, actually the start of the burnout cycle is drive, it's ambition, it's focus. It's like, this is like, it's fast paced, it's good. It's like, exciting, I'm driven, I'm ambitious. But actually, if unchecked and it continues for a long time, we end up moving through that burnout cycle. So it can also, the narrative changes, I guess, the longer you're in that kind of state. It can feel quite buzz-like to start with. If you think about the physical symptoms of anxiety, it's very similar to excitement. Especially if you're new in that industry or you're new in that job, you're kind of running on that adrenaline and using it to your advantage. But if you keep in that environment for a long period of time without that downtime, it does end up as, kind of move through the anxiety cycle, then eventually burnout, essentially.
And the other one you said, which I thought was actually very, very interesting, which was the emotions that are related to anger, So if you see, again, a lot of the high-end chefs back in 80s, 90s, driven, full of anger, and then if you look at the underlying things, there's a lot of issues there. But at the same time, what I find is that when you're in that sort of high pressure state of anger and you have to lead a team, you're also making them feel the same, and you can't even make decisions. So that's what I'm saying. Like, I think hospitality is such a unique mental health space because it's day in, day out, and I was also listening to another podcast with one SAS guy, and they're taught to be calm in the worst possible moments when there's bombs and they're being shot at, whatever it is. They just have to stay calm, roll up a cigarette, chill out for 2 seconds to then make those decisions that are going to save their lives.
And not create a freeze response as well, right?
It's the brain, right? When we experience intense emotions, especially the things like the anger and the anxiety, the ability to think clearly and make rational, sensible decisions where we have considered various perspectives, it becomes impaired. Right. It's not something that you can say, okay, it becomes impaired. That's why it's really important to calm the body down, because the same way when the brain detects threat, it signals to the body.
Okay.
Without you instructing.
Like, get ready.
Yeah, you don't instruct your heart to start
because the
racing.
adrenaline's already getting you ready, right?
Absolutely. So it also works in the reverse. As you calm your body down, it's also sending signals to the brain that, okay, we don't need to be alert. Everything's okay. Everything's fine. Yeah.
It's just, I think it's so interesting. Now, the other thing I sort of mentioned before, so I never, ever have my phone on the show, ever, right? But, you know, I'm part of the Dubai Chefs Collective, and, you know, we have some really incredible people on there. And I opened the topic a couple of days ago to say we're having some amazing psychologists in. And then the group chat literally exploded, and I haven't seen it go off like that in such a long time. And, you know, one person who I won't mention just said this, and which is really, really important. Hey, I have a lot of questions for the podcast. For someone who has suffered immensely with mental health to the point I nearly lost my life, I am finally at the other end. I would definitely like to add some questions to that, which I thought was incredible. So that reached out from one person, and then the same person, you know, has some incredible sort of questions about, you know, advocacy in the culinary world, for example. Are there any organizations, initiatives focused on supporting mental health? So, of course, we're going to talk about yourselves. Rebuilding after a crisis, for a chef or a hospitality professional who has reached a point of crisis, such as self-harm. What does the journey to recovery look like, and how can they rebuild their passions for cooking, whilst healing emotionally? Chef-driven change, and then again from the group, because I've got to read them out just to show you the level of enthusiasm that we had here. So, you know, one chef said, look, I'm completely burnt out. The kitchen is a tough place, but we are tougher. Always remember that we're here for a reason. Growth comes with mistakes, not perfection. I mean, there were so many. Considering high pressure, long hours, culture, toughness, is it possible for chefs to truly achieve mental health and well-being without fundamentally changing the industry structure, or are we just managing the symptoms of a deeper systemic issue?
It's a deep one.
When there's always something to be done, new trends to be following, social media content every day, how do we allow ourselves to stop without feeling guilty and feeling that we aren't doing enough or that we're not enough? So it's such a incredible topic, and that's why I really wanted to get you guys in, of course, to introduce you, but also from the different things, you know, that I hear, it's really important, especially about the recovery. If you've gone through a crisis, you know, how do you then begin to recover with something like self-harm, which is not spoken about often? And as you know, chefs have, you know, and hospitality professionals, they have easy access to knives, whatever it may be. It happens. How do we stop those triggers from happening to start recovering?
I think that it's really important to highlight that recovery is possible. And sometimes as therapists, if a client doesn't have that hope, we hold the hope for them and we share that, okay, things can get better. And we've mentioned things like tools and skills, understanding why one self-harms. What is triggering this self-harm behavior? And people self-harm for a range of reasons. It could be anything from feeling a sense of I'm losing control and a way to gain some sort of control. It could be a way of expression. It could be a form of release. So understanding maybe some of the triggers that leads to the self-harm, and also thinking about what we would call adaptive ways of coping with stress.
Love that. Okay.
Yeah.
Tell me about those.
Adaptive ways of coping with stress. Adaptive ways of coping with stress. first of all, acknowledges that we will all experience stressful situations, but what are the helpful things that we can do to respond to stress? And that includes things. So we talked about TIP. So TIP would be, sorry, we didn't mention TIP. So TIP is an exercise that we use when people experience really heightened distress and maybe thoughts of self-harm or thoughts of engaging in an unsafe way might come about. So the T stands for temperature. So that would be that walk-in freezer fridge thing. So kind of changing your temperature. I stands for intense exercise. So, there's that build-up of adrenaline and build-up of cortisol when we feel intense emotion. The first P is for progressive muscle relaxation, so relaxing the body, because when we are tense, our bodies, or when we're really anxious, or when we're really scared, our body tenses up because it's getting ready to mobilize itself to respond to some sort of threat. And then the other P is for paced breathing, so slowing down that breathing and sending signals to the body that, okay, we're calm, we're safe, like we're cool. So equipping people with some of those practical tools to use when the urges or the thoughts of self-harm might come about. Yeah,
I really love that also, because TIP is easy for hospitality professionals to remember.
Yeah,
but it's I think it's amazing. So then, if people wanted, again, let's say, we hold ourselves to real hardcore account, specifically, and again, we're in Dubai. It's a fast-paced 200 mile an hour place. There's lots of places, people to see, people to go, be seen, be at the very best, and gastronomy is the same. Dubai is the Middle Eastern capital of gastronomy. There are over 16,000 restaurants here. You've got the Michelin guide here, 50 best, all the best guides in the world. And you also have the pressure to survive, and to pay the bills and all of that kind of stuff. If people wanted to reach out, how would you tell them, first of all, where to go and what to do?
Stage. But I guess so I guess they're communities. So like the collective that you have, it sounds like a community of people that have shared experiences in the same space. And I think that that's really powerful, even sometimes before considering professional help, because what you're doing within that group is you're destigmatizing the conversations around mental health challenges, around struggle. And that helps people feel like they're not alone, that they're not the only ones that are struggling or finding certain things hard. Yeah, so just creating that culture and that environment of it's okay to talk, and it actually being okay. So that the group that you have is very important in that. And when we talk about our mental health as well and maintaining good mental health, it's thinking about things that we do outside of the workspace. So like the social connections, like the hanging out, the having a laugh, those things are really important for our well-being. And then in terms of professional support, obviously you have myself and V, who are clinical psychologists, and we work with a clinic. And
and I would say it's thinking, social media, it has its downsides, but it also has its upsides when we're thinking about some of the narratives that get created, right, about mental health and help seeking.
Right.
And actually looking at kind of people's social media. What do they talk about? What does this sound like relatable? Does this sound like me? Does this sound like something that actually is relevant or that is getting my interest? Just to be able, again, you're normalizing conversations, and the more we're exposed to these conversations, the more they become normalized. And then kind of thinking about, okay, if you are going to reach out to a professional services, I think the number one priority is finding someone who feels like the right fit for you. So like, for example, so thinking, you were saying before about men, kind of how maybe they are stereotypically or known to kind of talk less about emotions or be less likely to help seek. And that's probably right, like the stats all lean towards kind of, higher prevalence in women, but actually it's probably more because men are less likely to speak up or to kind of complete those questionnaires in the same way. And, sometimes we have people who, like men in particular, who be like, I only want to speak to a male therapist.
Right.
Whereas actually majority, surprisingly, would be like, I would not want to speak to a male therapist. I want to speak to a female therapist. And it's such an individual thing. Same with culture. So it's about doing your research to find who is likely to be the right fit for me. Because, we were talking about it needs to be a safe space, right? If you're going to take that huge step to kind of speak to someone, if it's not something you're used to, you need to feel safe. And these things, sometimes they matter in terms of who you feel most comfortable talking to and why, right? That might be different for different people as well. So kind of doing research, having a look, how do these people, like if you're going to see a therapist, for example, what do they talk about on their platforms? How do they, what kind of things, how do they speak about things? What narrative? How do you feel when you're listening to them? All of that work before you even pick up that phone can be a really helpful way. And in all of that, you're normalizing. You're socializing yourself to help seeking. You're kind of creating more kind of like almost demystifying and destigmatizing it. And then, like we were saying, sometimes it can be helpful to have that 15-minute check-in call with someone just to be like, look, this is where I'm at. This is what I'm experiencing. Is this something that we can do something about? Like, what does this mean? Is this a thing? Like, having that conversation before you even make your appointment can sometimes be a route into getting the help that you need. But again, with the social media side of things, it's being selective, isn't it? There's lots of information out there, particularly here in this part of the world. There's lots of different ways of looking at well-being and health, which, and some of it's amazing. Some of it's a little bit questionable.
Yes.
So it's about being selective, right? Like, where are you getting your sources of information from? Where are you getting kind of referrals to people from? Like, it's not a one size fits all, right? So someone might have found this particular person really helpful, or someone with this particular training background, but it might not necessarily be the right fit for you. So it's thinking about what are your individual needs. It can be really helpful to have those recommendations because it feels safer, but it's about being critical about it, right? And thinking about, okay, that sounds great. Is this something that would fit with how I want to look at things? So there's lots involved, isn't it? It's kind of using support groups, your existing communities and your support networks, and then thinking about, is there a role for professional help here? Like, what is it that I'm kind of needing? And some people, they feel more comfortable speaking to a professional than they would their support network, and that's okay too, right? Because sometimes the systems aren't in place.
Well, that's the reason the Dubai Chefs Collective was formed, is because we wanted to have professionals who went through the same sort of thing. There was never that network before, and we wanted to sort of have no ego in the group. And one of the things that we actually have, like a piece of paper, one of them says, like, don't be a dick, like straightforward. Everybody needs to be, we're all on the same page here. But none of us are psychologists. We're just there to have a chat should you require it, which is really,
and that can go a long way.
Right, absolutely.
Like such a long way.
But the other thing I wanted to sort of talk about, which you said earlier, was the check-in. Now, there was a story that broke globally about one of the biggest and most famous chefs in the world, who had made a difference. I'm talking about a monumental difference in the landscape of gastronomy. Heston Blumenthal. Now, he was sectioned by his wife. And it comes out now that he's bipolar. But the history of Heston is, from his work perspective, he was working 120 hours a week for an extended period of time, of course, and then becoming more obsessed with different things to the fact that it became rather dangerous. And they mentioned that had he not been sectioned, he was almost like 4 to 5 days away from death. And the decision for his wife to do that must have been an incredibly brave one. But then when it comes to, as you said, your friends or your community, if somebody is not dressing in the way that they normally would, or they're not talking the same way, how would you approach your friend or your sister, family, whoever it is in your community? How could you approach them in a safe way, but you're still checking in? Because I think that's important.
I think curiosity can go a long way. Just a simple like, how are you doing? Or even just reflecting on what you're noticing, but in a gentle way. Like, I noticed I haven't heard from you so much recently. How are you?
Yeah.
So you're kind of saying you've noticed something. Because if you just ask, how are you, sometimes it's like,
It's quite generic, right? Because we can all say, I'm fine.
I'm fine. Whereas actually if you're reflecting something, it's not too exposing, but it's just kind of saying like, look, I've just noticed you've not been yourself. You're kind of saying so many things with that. You're saying that I can see, I notice, I care, I'm concerned, all of those. And it's just, all you've done is reflect on something that you've noticed. So you're opening the conversation with curiosity.
Right.
Can go a long way in terms of just being able to start that. And then, if someone says I'm fine, but you're noticing that maybe they're not, go back a little bit later. Like, that continual check-in. It doesn't just kind of end after that first point. And it may be that what you're reflecting on changes with time if that person's still saying that I'm fine, or even just saying, look, I'm here if you do want to talk, or I'm here if you need, just let me know. It can be quite comforting as well if someone, because you also want to respect privacy. It's that fine line, isn't it? Whilst concern, but also not wanting to kind of push. It just depends on the level of concern that you have, I guess, when it comes to that. But just those open questions, I think, can go such a long way.
And Bisi, you deal with adults, and adults not particularly, some can be extremely open, some not. Some will say, oh, it's my privacy. How would you then, if it's somebody a little bit closer to you, how would you then, again, approach them in a nice, respectful way, but that something is really going on with their mental health?
I think similar to what V said, to be fair. But if you have that closer relationship with someone that's a bit more intimate, maybe you can more explicitly notice or name what it is that you're noticing. I think when it comes to checking in with our loved ones, the most important thing is for them to know that we're there. We're not to play the role of therapist in their life, because that can be difficult, because you, as much as you want to support, you might not be equipped to deal with what they're about to share. And you might not even have the time, resource to sustain that. And a person might feel rejected or dismissed, that you just asked me, I've just opened up to you, and now you're too busy. Yeah, so that can be difficult. So it is kind of almost thinking about what you're asking. And also, I guess, suggesting to them that this is what I've noticed. Sounds like you've been worried a lot recently, and maybe you can think about speaking to someone. If you notice someone has been a bit more withdrawn, inviting them out. And like V said earlier about activating gradually, it could be like, do you want to come round to mine?
Okay.
Or shall I come to you?
Or shall I come to you?
Right.
Should we go for a walk? And there's something about walking side by side or doing something side by side with someone that makes it easier to talk.
Got you.
Because facing someone,
it's more confrontational, right?
Yeah, and it can feel quite intimidating and scary for the person. So if you're going for a drive, should we go for a drive this weekend? Or should we go for a hike? Or I'll come round to you. You're cooking, you're making something, and you're just having a chat. It opens up the conversation in a caring, but also quite a containing way. Yeah, and it's important that if you are going to speak to a loved one, a family or friend about a concern that you have in mind a couple of places where you can direct them to.
Okay, beforehand.
Yeah,
right.
It's good to kind of have that, like, I follow this person on Instagram. Maybe you should check out some of their stuff. It might relate. Or maybe recommend, I don't know, like a therapist or a group or something like that. I think it can be quite helpful to have something in mind that maybe you could refer them to, or just suggest for them. Yeah.
Or do that collaboratively sometimes as well, right? Like, so I've had some people who have been like, oh, my friend kind of was like, I think you should speak to someone, and they sat together and just kind of did a bit of research or had a look at various platforms. So you're kind of saying, I'm with you. I can't, you know, it's I can be with you as much as I can on this journey, knowing your limits, as you were saying, but kind of directing them and supporting them to, and even by doing that, having someone already in mind or doing it collaboratively, you're normalizing help seeking. You're kind of just saying, this is normal, this is the thing, like, let's go speak to someone kind of thing. So you're destigmatizing it just by doing that, or saying that you're aware of these places. You're kind of, again, you're demystifying it, like, this is just normal to have these kind of contacts.
And we would do that with physical health stuff. We'd be like, oh, you should see this, I don't know, orthodontist, or you should see this, I don't know, psychologist or something.
but also when it comes to sort of approaching people, and I'll talk to you about it in a sort of very in a personal perspective. I lost my dad due to alcoholism, right? And this is really, really mental. When I was doing my degree in as a chef, I thought it would be a really good idea to become a nightclub bouncer and do it at the same time, because I thought, I need a place to hang out with my friends. I don't know what I was thinking. In the end, so I did that, and it was ridiculous, but I ended up hating alcohol, right, because of what it does to people, right? Now, the other thing that is quite prevalent within the industry is that sort of release when you've got your day off, you know, and chefs have turned to alcohol or different vices. Now, if you have a friend or a loved one that you know has an issue with these things and you want to approach them, what's the best way? Because I'm asking because when I did that and I said that to my dad, and I said, Dad, have you got an issue with alcohol? Of course, he was like, what are you talking about? I don't have any issues. And it became quite confrontational. What is the best way to approach someone in that respect? They know they have a problem. You know they have a problem. You're trying to help them, but they just become mega defensive. What's the best way to deal with that?
I guess just also holding in mind what's the function of it. Like, it's a coping mechanism, as you said, like that release that comes on those days off. It's a coping mechanism. It's coping with something not the most helpful, but it's a coping mechanism. So kind of, again, with that curious questioning, that kind of more open, you know, like, how are things? Because you're noticing something, and then kind of going into it, you're kind of building up to a conversation, essentially. You might not necessarily go in with that straight away. So some people might benefit from that.
But that's the thing, is that I want to understand in a way, because some people would be like, bulldozer, go in, you know, you've got a problem. And I think maybe the softer approach is, I don't know, because in your experience, what's best?
I think it depends.
Yeah, there's no right or wrong. Some people really appreciate that direct, and actually some people will say that was my wake-up call, right? When someone named it in this way, you're naming it. You're giving it words. You're giving it language. It's something like you're saying, like, you might know, they might know, but no one's really saying it. It's not got language yet, right? It's this unspoken thing, and actually naming it out loud is exposing. But some people find that as a motivator to then go and do something about it. For others, though, it can be quite like it naturally, if it feels like a threat, if it's something that they're not perhaps ready to kind of face or feel quite shamed for because it's been called out, perhaps, you know, they were feeling that people didn't notice or any of those things, it gets our defenses up. And then you can't actually hear the message, which is that there's help out there, or, you know, are you okay? You're in that threat space that it's defensive. You get a defensive response.
It's all coming from a place of love, because you want to help that person. However, I mean, even if you're not qualified, right?
Yeah. Saying that is coming, like, I'm concerned about you, it's because I care, and that this is coming from a place of love. So that kind of curious, compassionate versus sometimes direct, right?
Okay,
some people are like,
cool. So curious and compassionate. That's the
and you can be direct and compassionate too, right?
I love you, but And then the other one that also was mentioned is, again, you've got the big thing that happens specifically, again, within hospitality, because it's so relentless. People still want work-life balance. At the same time, believe it or not, and I don't know if you've heard this professionally, within hospitality, in the larger establishments such as, you know, large hotels and things like that, there's a lot of politics happens internally, which and chefs are not politicians, they're just super direct. And I think, and also people who are, you know, the waiters, the managers, they're givers, right? How do we build up mental resilience? Yeah.
It's a big one, because what happens systemically in that space impacts the individual. So it's creating that culture of psychological safety.
Okay.
Yeah. Resilience. One way that we build resilience is going through adversity, going through challenges. But we also build resilience when we're not necessarily going through challenges, just by strengthening our positive coping strategies and our positive, the positive strategies that we have. I would say that within the kind of hospitality space, especially with like leadership, what kind of message are you sending to the rest of the team? And that message is in work-life balance, is in terms of the hours that you work, is in terms of how you speak to people, how we deal with things like perfection and these really high standards that I guess needs to be maintained in order to keep the reputation of a particular establishment. Are people comfortable to share if they are struggling, if they're experiencing challenges? Is time off for a limited amount of time, is that acceptable? How do we deliver critique? Like, is it quite confrontational criticism? Is it humiliating? Or is it, this is an opportunity to grow? Maybe we should introduce some mentorship. So there's a systemic thing that needs to be considered in terms of building that mental resilience.
Yeah, because it is really important to understand yourself and how you build your personal resilience, but you can do all the work on yourself in the world. If you're walking into an environment where it's not safe to make a mistake, where it's not safe to kind of express an opinion or ask for what you need, all of that work, like if you're facing those, it's not going to, you know, the outcome is still going to be the same, right? Like you can do all of that work, but if that's the environment you walk into every day, so it does start a bit broader than that. Like it has to be a whole systems change. Like you're working with yourself, but it's also the system around you. Like, is this somewhere where you can then lean into that resilience? You know, we talk a lot in therapy about leaning in versus struggling against. Like if there's things outside of your control, how do you lean into them rather than struggle against them? But actually those things that are, you know, you can't lean into a psychologically unsafe environment without experiencing burnout.
Yeah, okay.
So, you know, those things that you are outside of your control, when you think about it, is this something that is helpful to me going forward? Kind of brings it back to that values-based kind of living. Like, is this aligned with my values? If the environment is consistently, it's not safe to collaborate, to share ideas. Like, do you feel included in decisions, you know? Resistance to change that often comes from when we're not included or employees aren't included in, you know, there isn't a transparency and things like that. So, you know, what is it that you're leaning into? How much can you realistically lean into that without compromising your values and that value-driven living?
The other thing is, the reason why I got into cooking is because, I'm half Venezuelan, so from South America, half British, so hot and cold, we could say. And you know, I loved sort of cooking from a very young age because of the whole family thing. On the flip side of that, when I was super cooking mega professionally, I hated cooking on my day off because I was just cooking. And then it just became like a thing that I ended up hating, which wasn't healthy. But I want to also talk about, you know, cooking as a therapy and also the psychological benefits of communal eating, because we are still, I believe, we just come out of a pandemic, you know, 2020, and I still feel...
Still recovering.
Yeah, still recovering from that. And during that time, I think it tested absolutely everyone and anyone to its absolute core. And then specifically within the industry, the way that the UAE tackled it was incredible. And then it felt like, and when I spoke to all of the professionals, it felt like normal punters, let's say, had a newfound love for restaurants and newfound respect for waiters and that kind of thing. Now, I wanted to sort of get your take on, again, you know, cooking as a therapy, whatever type of cooking it may be, and also those sort of communal exercises when you are with people. Why is it so good for the soul?
Brings about that connectedness, right?
Which is our soothe system, like we were talking about before, right? It's how we regulate. And when we're bonded with people, we get that oxytocin release.
Yes.
Right.
So it brings that, right? The social side of it.
But I think also, how many benefits? I mean, is it really important to sort of spend that weekly time with the family or with the friends doing the barbecue or whatever it may be?
I think it's really important. So we've spoken about our soothe system, but it's also a good way to build relationships. It's a good way to shift your attention and your focus from maybe the things that are stressing you out. If you're actually concentrating on the barbecue and you're in the moment, you're thinking about how brown the meat looks, you're thinking about the smells, you're hearing like the sizzling. If you're really concentrating and connected to that, your mind isn't necessarily focused on that thing that's happening at work that's making you anxious. So cooking and being with family, being with friends, and that social aspect can help redirect our focus to these positive experiences. And if we think about maybe like family, especially living here as well, it's that sense of being in touch with our roots, being in touch with our culture, which forms an important part of our identity, an important part of who we are.
And food is such an expression of that as well, right? Because like if you think about it, so there's us two here, like we're both born and raised in the UK, but our food memories were both related to our cultural identity, right? It wasn't related to, you know, where we've grown up or anything. It's so much more than the food that's on the plate. It's like our identity, our culture, our roots, the memories that come from that, as well as the sensory experience that you were just describing. And when you think like we do sometimes do an exercise called mindfulness of taste. And we will get...
Tell me all about it, please.
And I'll do this in groups often when I'm doing like a group activity or something.
Here's a chili.
Can you imagine? We should start doing it with chili. Let's test your rich sensory experience.
That'll be a new group thing at Sage Clinics that you do, right? Okay.
Absolutely. I won't be participating in that, by the way. I won't be able to cope. And actually traditionally it was written like with a raisin.
Oh, okay.
And like you have to observe and taste this raisin as if you've literally dropped from Mars and you've never seen anything like it before.
Really?
And it really makes you slow down and focus on, because you're looking at smells, you're looking at taste, you're looking at texture, you're looking at what does it feel like before you eat, what happens in your mouth when you put that raisin in your mouth. So it's a really rich sensory experience, but it's another example of how to ground ourselves and be present.
And slow.
Like, I often say in some of my group sessions when we're talking about mindfulness, like I catch myself sometimes, right? I will be having my dinner, I'm watching Netflix and my phone's also there. We're not usually used to focusing, or, you know, we get just caught up in the business, particularly here, right? When you were talking about the fast-paced environment. So something like having a mindful mealtime is often one of the things I'll suggest. Is like when you are, okay, so what's everyone doing at mealtime? Where are you all? Oh, this person's in this room, this person's here, or we might be on our phones while we're eating. It's kind of like, what does a mindful mealtime look like, right? How do you stay present? And that's usually no tech, focused on what you're doing, what you're having, the conversation at the present, because it's about slowing down and using food as that anchor, and meal times as that anchor. One for the social element, but then also the regulation element, how you ground yourself, how you focus, and you get that downtime. For the 30 minutes or whatever it is that you're having a mindful meal time.
And also thinking about the act of preparing a meal and what that represents. Think about, like we often say, do you want a cup of tea? It's almost like you're thinking about me as you're going into the kitchen and you're considering me when people are sick and we bring food over. It's a sign of affection, it's a sign of love, it's a way that we indicate that we care about someone. I'm personally not necessarily a fan of cooking. However, I like standing in the kitchen while someone's cooking and we're just chatting.
Right.
And I'm like passing stuff and throwing things in the bin and washing up. And it is that shared activity, shared experience. And like I mentioned earlier, there's something there's something opening about having conversation when you're not directly looking at someone, so you can talk about your day. It's a nice time to catch up. It's a nice time to share, and also thinking about tasting. Oh, add a bit more of that. It's a way to just be expressive and experiment, which is good for one's mental well-being, and it's just good for our general health.
Yeah, I think the other thing is that when I've led a lot of teams before in kitchens, and I know something is wrong with somebody, and I did it without even thinking, is I would just stand next to them, set up a chopping board, and it's like, oh shit, chef's next to me. But then I'd start talking to them as they're chopping. Yeah. And we're like, you okay? Yeah. And then we start having that conversation, and then they open up, which is really funny actually, because during the service, I'm normally on the pass, controlling the checks and all that kind of stuff. But when we're prepping and you're standing next to someone, they really do open up. And the other one is, from a personal perspective, my wife will know if I'm angry at home or I've had a really bad day if I'm making bread. Okay. Because I smash it out on the bread.
Yeah, that's good.
But I think the kitchen generally at home tends to be that sort of safe space, communal.
Sort of a hub.
Right, yes, exactly.
And you're creating a safe place there, like just by standing and doing something, a shared activity, you've created a safe space there for your colleagues or, whoever you're working with, because you're just you're there.
It's amazing. So now, ladies, we have come to the quick fire round. Okay. So I've tried not to make it too crazy. I'm going to have to ask both of you, even if you don't cook.
Okay.
All right?
Don't cook much.
Sorry.
I'm Nigerian, I have to cook.
So, V, I'm going to start with you. Okay. Apart from chilies, what's your favourite ingredient?
Oh. Gosh, that's a tough one.
Well, I can put it down as chili if you want. It's fine. I don't mind.
Chili, yeah, absolutely. My favourite.
Yeah, okay. Very good. Very good. Bisi, for you?
Oh, my favourite ingredient. Probably say a chili.
Okay.
So that sounds boring. Yeah, right. I like spicy food.
All right, done. Spicy or pickled?
Pickled.
Spicy.
All right. Fish and chips or Sunday roast?
Sunday roast.
Oh, boom. Morning tea or afternoon tea?
Afternoon tea.
Afternoon tea because it's fancy, but I need a cup of tea in the morning.
Right, okay.
Both.
Okay. As of right now, what are your top 3 cuisines that you love to eat?
Pan Asian.
Yep.
Which is a great place for
awesome.
it.
Yeah.
What else? Indian.
Yeah.
Although it's never quite like my mum's cooking. And I'd say the roast.
Okay.
Yeah, English roast.
Yeah. I don't want to copy, so I'll think of something else. Nigerian, definitely. Pan Asian. And I would say British meals because it reminds me of just being back home.
Nice.
Yeah.
Now, I know that you're not been in the industry, but I want to understand from all of your years of experience eating out, what's been the funniest restaurant incident that you've seen or been involved in? All right, V, we'll go with you, please.
So I was a waitress.
All right. Back in the day?
Back in the day, fresh out of uni on my undergrad, the reason this comes to mind is because social anxiety went through the roof after this. It was day one opening of a new restaurant in the town that I lived in.
Was it a posh restaurant or just a general nice
I'd
restaurant?
Say mid. So kind of like it was a seafood restaurant.
Yeah.
Mid-range, I would probably say, but brand new, obviously. And the town I live in is very small, so lots of people. My dad owns a business in the town, so lots of people know.
They knew you.
My face.
Okay.
Day one, lots of pressure from management. This is opening day. We need to make a good impression. Excellent customer service. And I spilled. I was about to say threw. I didn't throw. I spilled an entire tray of drinks.
Oh.
Down myself and them.
Oh no.
Okay.
Everyone's giving me daggers. I just want to crawl in a hole. And then I was like traumatized after.
It happens to all of us. Yeah. So
I'm glad. Normalised.
So it happens to all of us. Don't worry.
I'm not alone in this experience.
Did you have to continue the shift?
I had to. This was pretty early in the shift, and I had to continue with a completely
it's tough.
Wet apron t-shirt. The lot
smelling of everything. Yeah. And everyone going. Ah!
In a seafood restaurant as well.
Yes,
Yeah.
there was a whole mix of things going on.
Okay, all right. Fair enough. Well done, though. Well done.
Yes.
Okay.
I feel like I'm recovering from it slowly.
All right. Bisi, for you?
So we went to Nando's.
Yeah.
This was also back in the day. So this was a new Nando's that just opened in the area. And on the Nando's menus back in the day, it was like elbows on the tables, don't eat with knife and fork, talk with your mouth open, and like with your mouth full of food. And that's what I did. And I got in trouble by my mum because I was like, like I was probably about like 12.
Right.
I took it to like the next level. And then they had like the refillable drink station. So I mixed all the drinks together and then I started drinking it. And then I threw up
Oh my God.
on the table.
Good work. On the
How old were
table.
you?
I was about 12. Just know that I got in so much trouble because
Wow.
my mum was so embarrassed. Because we had like a long table because there was a group of us. So yeah, that was funny but extremely embarrassing.
Okay. Now, what advice would you give to anyone who just needed a hand or wanted to talk?
I would say reach out. It sounds more scary in your head than it actually is. Yeah, and just remember you're connecting with a human first, and you connect with humans every single day. So I would say just reach out.
Amazing.
Yeah.
Me?
I would say the same. Like it's okay to ask for help.
Yes.
You're not expected to have all of the answers. Why would no one does? We don't have all of the answers either, right? It's okay to ask for help. And taking, like as you say, taking that first step is often the hardest bit, but it's often like more often than not, it is not as you expect it to be. And it's a lot easier once you get through that door. So it's okay to talk and ask for help, I would say.
Now, what advice would you give, Bisi, to 16-year-old self?
My 16-year-old self. All right, let me think back. I mean, it was only yesterday.
Yeah.
No Nando's.
16-year-old Bisi. I would actually say to 16-year-old Bisi, probably sounds very cliche, but just enjoy every stage. That rush to grow up means you're going to be experiencing lots of bills and lots of responsibilities in the future. So just enjoy each stage that you're at. There's lots to celebrate in this season. There's also lots to learn. And if you make mistakes, who cares? It's not the end of the world.
B?
Well, that's a tough one to follow. That's some very good advice. I would say focus on values rather than goals, right? When you're that age, it's like, I want to do this, I need to do that, and I want to go here. And actually, when you really slow down to enjoy the process, but you also focus on the why, like the goal might change. And that's okay. Or because if you're purely goal focused, you get there and then it's like, okay, well, now what? And I remember being, in those kind of years doing your GCSEs and to your A-levels.
Yeah.
If you're goal focused and then you get there, it's like, okay, now what's next?
Okay.
Whereas actually, if you're thinking about the why and the values, it's doing what brings you meaning rather than what you think you should do. I think that would be something that could go a long way to our teenage selves when we think about just slowing down and connecting with the why and the meaning rather than always chasing something.
Now, if anybody wanted to reach out through social media to the both of you, what's the best way for them to do that?
I would say Instagram. They can follow us on Instagram. They can contact the clinic. With Instagram, though, I will say that it's hard to monitor the DMs. So in terms of sessions, I would say probably contact the clinic. Just because it's hard. I wouldn't want anyone to send a message and I don't open it, because I take frequent social media breaks as well for my own mental health so that I'm not constantly stimulated. And because of the mental health page that I have on Instagram, there's a lot of mental health content. So as a way to also safeguard my mind, I'm not constantly on there. So sometimes I might miss messages.
Okay.
And I wouldn't want anyone to take that personally or feel rejected or feel like they've been dismissed. But we post helpful tips and strategies on social media, so they can definitely follow us on Instagram and LinkedIn,
like kind of all of the platforms. But like you say, I think going via the clinic is often the easiest way to make sure that you're getting a timely response for that. So and all the details are on the Sage page, like Sage_clinics, I think it is on Instagram, and kind of reaching out to our appointments team in the way that you feel comfortable, right? Some people, like, they can WhatsApp the clinic, they can do an email or a phone call, whatever you feel comfortable with, really.
And do you, so as well as in person, do you also do online?
Yeah.
Okay. So anyone in the world listening, they want to get hold of you through the clinic. Okay, so what I'll do is I'll put links to your Instagram and to Sage Clinics on the show notes so that people can get hold of you.
Absolutely,
right? Now, the other thing I wanted to sort of say is both of you are doctors. So you're the first doctors that we've had on the show, number one. So thank you very, very much. You're the first ever psychologists that we've had on the show. On behalf of the Chef JKP Podcast, thank you very, very much for coming on and giving us so much incredible information in such a short space of time. I believe this is probably one of the most important topics of our time to talk about this, specifically when it comes to hospitality, because we are known for just keeping everything in.
Yeah.
And really, the work that you are doing is 100% inspirational and really saving lives. I can tell you that right now. So I really cannot wait to see what you're going to do next. I think you're going to have a lot of messages and a lot of people reach out genuinely. You've been absolutely amazing, and I just want to say thank you so much.
Thank you so much for having us. You know, and it's, again, it sounds like the work that you're doing, even to have us on and to raise awareness about this, is amazing, and the work you're already doing in the group. So thank you so much for having us. It's been great.
It's been great. Thank you for creating the space for us, but also thank you for creating the space for chefs and people in the hospitality industry. Thank you so much.
Thank you. Wow. What an incredible and phenomenal, inspirational conversation. There was so much to think about. Now, during the edits, I found myself listening to different sections of the interview because there were so many points of brilliance, and they made it super easy to speak to them, as well as the way they break things down. It really helps to understand the complexities of mental health. I have also begun to use their techniques, which were mentioned during the show. Now, if there is one thing I hope you take away from this episode, it's that mental health is just as important as physical health. It affects every single part of your life, and ignoring it is not an option. Dr. Bisi and Dr. Gurveen, I wanted to say you two are absolute legends. The work you and the team do at Sage Clinics is nothing short of life-changing. And I cannot thank you enough for sharing your wisdom with us today. And whether you're listening or you're watching, if you or someone you know is struggling with their mental health, please know you are not alone. They are not alone. Help and support is out there. And it's conversations like this that really make the first step to making things better. This is an episode that deserves to be shared because you never know who might need to hear it. So please, do me a small favor, send it to a friend, a colleague, perhaps a loved one. This could be the conversation that makes all the difference. Massive thank you again to the two doctors and the entire team at Sage Clinics for the phenomenal work that you are doing. Now, I'll put everything in the show notes so you can get all of the usual links. Don't forget, you can now watch us on YouTube. And if you haven't already, make sure to follow, share, and hit that all-important subscribe button. I would just like to ask a small favor. If you like the show or think someone you know could learn a few of the lessons from the guests and the conversations, just like we have had on the show today, we want it to reach as many people as possible. So please don't forget to share. So many amazing lessons from today. I'm just blown away. At the same time, I want to say a massive thank you for you for tuning in and taking the time to listen or to watch the entire episode. Yes, you are a legend. Until next time, food is memories.